I became aware of the fact that I was having back pain about 5 or 6 years ago. And if I think back a long time, I've had back pain almost all my life. And so it's probably something congenital. And maybe there was something in the sports that I did in high school that made the problem worse. But I've had nagging back pain for decades. The biggest, I think, epiphany that something was really going wrong was that when I was running, and I have two faithful running partners, and we run early in the morning. It's dark, and you can't see a lot of things, so you're very aware of what you hear. And they told me that when I was running with them, that they'd started noticing a really slapping sound. And I realized that what I had was what's called fatigable foot drop, that after I ran a certain number of miles, I would start dropping my foot involuntarily and making this strange, slapping, obvious noise, which was really obvious to them and not to me. My normal activities certainly were compromised because I couldn't stand. And I lecture to medical students, and I give talks to my internal medicine residents. And it would be hard to stand for an entire hour without fidgeting around. I mean, I really looked as if I had some type of hyperactivity problem, trying to get comfortable. The other aspect of my job is that I do primary care for sports teams, Division I sports teams at the university at which I work. And a lot of that's sidelines. And sidelines, you have to be alert and, attentive. And I would have to squat, which was a difficult thing because if you were on a football sidelines and you were squatting and you didn't have a good visual on the field, you could all of a sudden see a ball sailing over your head with a receiver in a corner in hot pursuit, and you're squatting. And you don't move very fast. So that was a personal liability. When I decided to have back surgery, I wanted to be able to have back surgery as quickly as possible, like today. I didn't have to worry about it. But most importantly, I wanted to be able to recover quickly. And that Dr. Kevin Foley, was instrumental in helping develop and teach this technique. So I thought, great. There are a few other centers around the country, and I think actually he probably trained the surgeons at these other centers. A few other centers around the country that were mentioned, but of course Memphis is the center where Dr. Foley is. What I didn't anticipate was waking up and feeling immensely better than before I went to sleep, because I can remember lying on the gurney, waiting to go into the OR, and my back killing me because I was on my back. And I woke up on my back thinking, boy, I feel great. A little nauseated from the anesthesia, but I feel great. And the deep aching pain was completely gone. And I realized that my major goal for the next several months was to not act on feeling so good, that I was not to be encouraged, although I could inwardly just feel myself. I was going to leap out of bed and start trotting around the nurse's station because I felt so good. After about 4.5 months, I got another CAT scan which showed some nice fusion. And not complete, but definitely on the way. And so then I got leave to run. And that's actually when I count my life as becoming normal, because for me, running is normal. I do exercise every day. And I actually don't do running. I haven't for some time every day, but I cycle or lift or spin or power walk or hike or horseback ride or something. And so that signals to me that I could get back to my major activity, which has really been running. And I was back at work full time. And I did, at that time actually, I decided to celebrate my 3 or 4 months of hanging around at part-time speed. And I went to Europe.
There are no adequate and well-controlled studies in human pregnant women. In an experimental rabbit study, RHBMP2 has been shown to elicit antibodies that are capable of crossing the placenta. Women of childbearing potential should be warned by their surgeon of potential risk to a fetus and informed of other possible orthopedic treatments. The safety and effectiveness of this device has not been established in nursing mothers. Women of childbearing potential should be advised to not become pregnant for 1 year following treatment with this device. A brief summary of indications, contraindications, and warnings for Infuse bone graft and LT cage lumbar tapered fusion device, or Infuse bone graft and interfix threaded fusion device, or Infuse bone graft and interfix RP threaded fusion device. The Infuse bone graft Medtronic titanium threaded interbody fusion device is indicated for spinal fusion procedures in skeletally mature patients with degenerative disc disease, DDD, at one level from L2 to S1, who may also have up to grade 1 spondylolisthesis or grade 1 retrolisthesis at the involved level. The Infuse bone graft, an LT cage lumbar tapered fusion device, is to be implanted via an anterior open or an anterior laparoscopic approach. Infuse bone graft with either the Interfix or Interfix RP threaded fusion device is to be implanted via an anterior open approach. The Infuse bone graft Medtronic titanium threaded interbody fusion device consists of two components containing three parts: a metallic spinal fusion cage, a recombinant human bone morphogenetic protein, and a carrier scaffold for the bone morphogenetic protein and resulting bone. These components must be used as a system for the prescribed indication described above. The bone morphogenetic protein solution component must not be used without the carrier scaffold component or with a carrier scaffold component different from the one described in this document. The Infuse bone graft component must not be used without the Medtronic titanium threaded interbody fusion device component. Note: the Interfix threaded fusion device and the Interfix RP threaded fusion device may be used together to treat a spinal level. LT cage lumbar tapered fusion device implants are not to be used in conjunction with either the Interfix or Interfix RP implants to treat a spinal level. The Infuse bone graft Medtronic titanium threaded interbody fusion device is contraindicated for patients with a known hypersensitivity to recombinant human bone morphogenetic protein 2, bovine type 1 collagen, or to other components of the formulation, and should not be used in the vicinity of a resected or extant tumor, in patients with any active malignancy or patients undergoing treatment for a malignancy, in patients who are skeletally immature, in pregnant women, or in patients with an active infection at the operative site or with an allergy to titanium or titanium alloy. Please see the package insert for the complete list of indications, warnings, precautions, adverse events, clinical results, definition of DDD, and other important medical information. The package insert also matches the sizes of those sized devices that are indicated for use with the appropriate Infuse bone graft kit. Caution: Federal, USA, law restricts this device to sale by or on the order of a physician with appropriate training or experience. A prescription is required. Please consult your physician for a complete list of indications, contraindications, benefits, and risks. Only you and your physician can determine whether this procedure is right for you.